Hi everyone. In this video, we are going to discuss about principles of mental health nursing. Myself, Shiny, lecturer, Triplum College of Nursing. A nurse who is responsible for total care of a person must take care of both physical and emotional needs of the patient or the person. She should develop a basic understanding and skills in psychiatric nursing to achieve total health care. In psychiatric nursing, we have 12 principles. These principles are based on the concept that each individual has an intrinsic worth and dignity and has the potentialities to grow, and also these are guidelines for nurses to observe in practice. So we'll see one by one. So this is the first principle: accept the patient exactly as he is. So accepting means being non-judgmental. Acceptance conveys the feelings of being loved and cared. A nurse should be able to convey to the patient that she may not approve everything what he does, but he will not be judged or rejected because of his behavior. So as nurse, we have certain ways to express our acceptance to the patient. The first way is being non-judgmental and non-punitive. The patient's behavior is not judged as right or wrong, good or bad. Patient is not punished for his undesirable behavior. All direct and indirect methods of punishment must be avoided here. So, and also a nurse who shows acceptance does not reject the patient. So, even when he behaves contrary to their expectations. The next way is being sincerely interested in the patient. Sincerely interested in the patient, what we must do is, as nurse, we need to study patient behavior pattern. We need to allow the patient to make his own choices and decisions, being aware of his likes and dislikes, being honest with him. We need to take time and energy to listen to what he is saying. We need to avoid sensitive subjects and issues with the patient. And the next way is recognizing and reflecting on feelings which patient may express. When patient talks, it is not the content that is important to note, but the feelings behind the conversation which has to be recognized and reflected. The next way is talking with a purpose. The next conversation with the patient must revolve on his needs, wants, and interests. Always we should have a interaction with patient. There should be a purpose. So avoid evaluative, hostile, probing questions and use understanding responses which may help the patient to explore his feelings. The next way is listening. So listening, it is an active process. The nurse should take time and energy to listen what the patient is saying and permitting patient to express strongly held feelings. So it is better to permit the patient to express his strong feelings without disapproval or punishment. So nurse must accept the expression of patient's strong negative feelings quietly and calmly. And then second principle is use self-understanding as a therapeutic tool. Psychiatric nurse should have a realistic self-concept and she should be able to recognize one's own feelings, attitudes, and responses. Self-understanding helps her to be assertive in life situations and without being aggressive and feeling guilty. The next principle is use consistent behavior to increase patient emotional security. Consistency. So consistency is used to contribute to patient security. So here consistency means having certain routine pattern. In psychiatric nursing, consistency means there should be consistency in the attitude of the staff, ward routine, and in defining the limitations placed in the patient. This consistency in psychiatric wards reduces fear and anxiety among patients. The next principle is give reassurance to patient in acceptable manner. Reassurance should be given in a subtle and acceptable manner. So definitely reassurance build patient confidence. At the same time, we should be very careful we, giving reassurance. We should not give false reassurance to the patients. The reason is it can also reflect a lack of interest and understanding. The next principle is change patients' behavior through emotional experience and not by rational interpretation. So, major focus in psychiatry is on feelings and not on the intellectual aspect. So, if you are giving advice, it will not effective in changing behavior of the patient. But role play and the social drama. So, these are the few techniques of providing corrective emotional experiences to a patient to understand, and definitely this role play and social drama will give insight to the patient. They will change their maladaptive behavior into adaptive behavior. Next principle is avoid unnecessary increase in patient anxiety. So unnecessary increase in patient anxiety should be avoided. So if we showing our own anxiety to the patient, so showing attention to the patient deficit, making the patient face repeated failures, or placing demands on patient, so which he obviously cannot meet, or passing short commands and showing indifference. So all these things will increase patient anxiety. So always we should be keep it in our mind. We should not increase patient anxiety unnecessarily. The next principle is demonstrate objective observation to understand and interpret the meaning of patient's behavior. Here, the objectivity is an ability to evaluate exactly what the patient wants to say and not mix up one's own feelings, opinion, or judgment. To be objective, the nurse should indulge in introspection and make sure that her own emotional needs do not take precedence over patient's need. And the next principle is maintain realistic nurse-patient relationship. So to maintain professional relationship, that is nurse-patient relationship, nurse should have a realistic self-concept and should be able to emphasize and understand the feelings of the patient and the meaning of his behavior. So the next principle is avoid physical and verbal force as much as possible. So all method of punishment must be avoided here. If the nurse is an expert in predicting patient behavior, she can mostly prevent an onset of undesirable behavior. Next principle is nursing carries center on the patient as a person and not in control of symptoms. So analysis and study of symptoms is necessary to reveal their meaning and their significance to the patient. Two patients showing the same symptoms may be expressing two different needs. Next principle is explain routine procedure at patient's understanding level. So all explanations of procedures and other routines are given according to the patient level of understanding. So the next principle is the last one. Many procedures are modified, but basic principles remain unaltered. So in psychiatric nursing field, many methods are adapted to individual needs of the patient, but the underlying nursing scientific principles remain the same. Some nursing principles to be kept in mind, that is are safety, comfort, privacy, maintaining therapeutic effectiveness, economy of time, energy, and material. These are the 12 principles we have in our psychiatric nursing. So as nurse, we should know all these 12 principles, and also we need to follow all these 12 principles. Thank you.